I wanted to make some comments today as both a respiratory and an infectious disease physician on the letter that was signed by over 200 scientists to the World Health Organization about the aerosolization of COVID-19. We know that with any respiratory virus, when people cough, when they sneeze, particles come out of their mouth, and they are full of respiratory virus. And those particles vary in size from very, very small particles that can remain suspended in the air, aerosolized, through to larger particles that tend to drop straight to the ground onto surfaces or indeed onto people if they are nearby. Respiratory viruses, and COVID-19 is no exception, have their primary mode of spread through contact and droplet. That is, that the overwhelming body of evidence suggests that the primary mode of COVID-19 getting from one person to another is larger droplets. Droplets that either fall onto people's hands and then you put your hands to your face so that's direct contact with an affected individual who's very close, or alternatively, large droplets land on surfaces, sometimes on kids' toys and things like that. We call those fomites, and then people touch that surface and generally touch their mouths, and that's how the virus gets in. That is contact and droplet spread. So what about this aerosolization? Is this an airborne virus? The evidence suggests that the majority of transmission, the vast majority of transmission is contact and droplet. However, there are laboratory experiments that have demonstrated that some of those tiny airborne particles can still contain COVID-19. You can find evidence of COVID-19 within those particles that are suspended in the air, that can travel for longer, that can deposit on surfaces further than 1.5 metres away. What we don't know is how relevant that is to people actually getting infected. And I'll give you an example. For viruses that we know are transmitted via the airborne route, chickenpox, measles, if you're non-immune, then, and you're in the same room as a person, you are highly likely to get that virus, but even if you're 4 or 5 metres away. If I had measles during the course of this press conference, the cameramen, who are currently about 3 or 4 metres away, if they weren't immune, they would get it. Pretty much guaranteed. You'll be all right, fellas. I'm sure you've been vaccinated. For COVID-19, that is substantively less number of people will get COVID-19 if you're in the same room. In fact, the basic reproductive number is much, much less. So one person on average affects 2.5 others. That is much more in keeping with a contact and droplet spread. Now, our infection control expert group, who are the leading infection control practitioners, the vast majority of whom are current practitioners in our hospitals today. They're infectious disease physicians, they're infection control nurses, they're experts in this area. They constantly review the evidence and provide updates to the Australian Health Protection Principal Committee, the AHPPC. So whilst we keep a watching brief on this letter that's been sent, this concept of aerosolization, it remains the position of the AHPPC that this is a virus that is primarily spread through contact and droplet precautions. That is not to say that we will ignore emerging evidence. We certainly won't. Our infection control expert group constantly look at the evidence. And if evidence emerges that this is more of a problem than we suspect, we will naturally change our position. But the overwhelming weight of evidence at this point of time supports contact and droplet spread. I would also like to indicate today and let you know that we have had ongoing discussions at the Australian Health Protection Principal Committee on the issue of community mask wearing in areas of high transmission. As you know, The position of the AHPPC has been and continues to be that in areas of Australia where there is no community transmission, 7 out of our 8 jurisdictions, we do not recommend mask use in the community. However, there is a part of Australia at the moment where community transmission is on the rise. Of course, that is Greater Melbourne and the Mitchell Shire. In those areas, mask use, surgical mask or cloth mask use is recommended if you find yourself in a situation where you cannot socially distance. This means that if you have to leave your home for any of those reasons for which it is permissible, and you are likely to find yourself in a situation where you cannot maintain 1.5 metres distance, it is advisable to be covering your face with a mask. That, of course, does not change our advice on social distancing. It continues to be the case that the most important measure that you can do to prevent the virus from getting from one person to another is to maintain your distance between individuals. That is the purpose of the stage 3 restrictions. It is the reason why they're going to work. They work the first time, they will work the second time. And that's because we are keeping our distance from each other.